Tonight on Primetime Politics.
After next week, more than 1 million bottles of product will have entered Canada.
Health Canada says 1 million bottles of children's medication will arrive in Canada by next week. We'll hear from a pharmacist about how far that will go in dealing with the crisis faced by parents this winter.
We had seen a trend of it getting worse and escalating and escalating.
The public inquiry on the Emergencies Act prepares to hear from federal ministers and the Prime Minister himself. Our journalist panel reflects on what we've heard so far and what to expect next week.
We know what needs to be done. We just now need the will to do it.
And this week, Alberta Premier Danielle Smith started her promised shake-up of the province's healthcare system. We'll look at where it's all headed. But we start with a much-awaited announcement from Health Canada on Friday that 1 million bottles of children's dose acetaminophen and ibuprofen are expected to arrive in Canada next week.
Manufacturers have ramped up production to record levels, but demand has continued to increase and significantly outpaced the supply. As a result, we've worked with manufacturers to allow access of foreign product to supplement Canada's supply. We've now received and approved 3 proposals to import foreign product, and supply has started to enter the country. After next week, more than 1 million bottles of product will have entered Canada to supply hospitals, community pharmacies, and retailers, and medications will start appearing on store shelves starting early next week.
Friday's announcement by Health Canada will come as a relief to the millions of Canadian parents who've been facing a complete lack of children's painkillers and medications as the flu, RSV, respiratory virus, and COVID-19 have filled the country's emergency and pediatric wards. But when will the average parent have access to the medications? And what about the shortages of numerous other type of over-the-counter and prescription medications? To discuss it all, we're joined by Pam Kennedy. She is a pharmacist in Bridgewater, Nova Scotia. Ms. Kennedy, first of all, thanks for joining us.
My pleasure.
I'd like to get your response as a pharmacist working in the community. When you hear the news from Health Canada finally that 1 million bottles are on their way, are you optimistic that you'll see them anytime soon? What's your reaction?
Yeah, absolutely. Yesterday we did hear from our provincial association that we were to expect this foreign supply sometime over the next week or so. So today's announcement by Health Canada is certainly encouraging.
How short have you been? Because we've heard stories of people who've been facing shortages for 5 months, like since last, April or May.
Yeah, certainly. We've seen that trickle effect where we've seen some supply and then it go, and then supply trickle back in, and then it go. And I would say that's been ongoing since the spring or early summer. We currently have no supply on hand for patients, and certainly when it has been coming back in, we have been limiting the number of products that patients are able to buy.
So when you're completely out of stock, I understand you'd probably be trying to make up a formulation, children's formulation from adult product of acetaminophen and ibuprofen for kids who've got fevers or in a bad way?
Yes, certainly. At pharmacies across Canada, and it's not at all pharmacies, but at some, one of the great things that has come from not that there's any great things that have come from this, but one of the things that has come from this is that one of our compounding companies has provided these formulas to pharmacies to be able to make or formulate these acetaminophen products by compounding.
How much distress have you seen in parents in the community when they can't get these, basically fever-reducing and painkillers for their kids?
Yeah, for sure. And obviously that's an obvious concern for parents. And, at this point, as we've seen some trickle effect of the medication, we have actually been able to provide it most of the time and or make these referrals to have the compounded product. We're also, as pharmacists and pharmacy teams, trained to recognize maybe in instances where these analgesics or pain medications aren't necessarily needed and maybe mitigate some of patients' and parents' worries.
We have been told, because I'm not a pharmacist and truth be told, I don't have any children, but we've been told that there's a lot of other products, including products for children, but a whole wide range of other pharmaceutical products that are in shortage. Can you go through what you've been facing?
Yeah, for sure. Well, drug shortages are certainly not new to us in community pharmacy. We see a wide range of products regularly that we, kind of come and go. Currently, I would say one of the areas or one of the product lines that we're seeing a lot of difficulty in is ophthalmic or eye products. So I'm drops and solutions that we would normally have to use after cataract surgeries or to be used for glaucoma. We're having great difficulty acquiring a number of those, and so working with our ophthalmologists locally to try to find alternatives for patients. One of the other ones being impacted by this increase in respiratory illness in children is oral suspensions for amoxicillin, which we often see being used to treat common childhood illness, and that in from some manufacturers isn't showing a return to supply until early 2023.
When you hear about those kind of shortages of, and you say some of them are because of the increased demand, but there's also these rotating shortages of certain pharmaceutical products, supply chains, everyone points to that term. What's your message to governments? What's your message to the people who have some sort of responsibility for this? What can be done as opposed to facing all these sporadic shortages of vital medications?
Yeah, certainly. I mean, there's a lot of things that go into, in my understanding, some of these drug shortages. It can be as a result of an increase in demand, which obviously is what we've seen here with the increased demand for acetaminophen or Tylenol. It can be a result of a manufacturer disruption. So there's lots of things certainly that that do come into play. What we have to keep in mind is that obviously Health Canada, here we face very strict, efficacy and safety standards. And so when they're facing these proposals for this foreign supply, they do have to ensure that the supply that they're bringing in does meet the safety standards that we're accustomed to. Okay,
last question. I'm repeating the first question, but you are optimistic that in a week's time you will start to see this product on shelves?
Yeah, we certainly hope that what Health Canada is saying today is definitely what is going to happen, and certainly the direction that we received from our Provincial Pharmacy Association yesterday is that we do anticipate seeing these in the next week or two, which should hopefully help mitigate some of the shortages that we've been seeing.
Okay, well, thank you for speaking with us. A lot of parents will be waiting anxiously and fairly happy to be hearing this news. Thanks a lot, Ms. Kennedy.
Yeah, my pleasure. Thank you.
When Danielle Smith became Conservative leader and Premier of Alberta about 5 weeks ago, she promised to shake up the province's healthcare system. Well, that overhaul started this week as she replaced the province's top public health doctor, Dina Hinshaw, and yesterday she scrapped the province's Health Services Board. She has also promised that there will never again be vaccine or mask mandates in the province, and Danielle Smith says the changes are just starting. To look at it all, I'm joined by freelance political commentator Graham Thomson. Graham Thomson, thanks for joining us.
My pleasure.
Okay, let's go through. I just gave the headlines about the two big changes already this week, and that is basically replacing Dina Hinshaw and also scrapping the 12-member public services, the Health Services Board, replacing them with an administrator. Describe a bit what's behind these changes.
Yeah, this is interesting because there's two ways of looking at this. One is that Albertans are really worried about healthcare. It's a big issue. It's a big issue across the country. When it comes to Alberta politics, number one issue is healthcare, protecting the healthcare system. Number two is affordability, but number one is healthcare. And Smith is going to try and tackle things like reducing the wait times for emergency care in hospitals and surgery times and ambulance as well. People say, yeah, good idea. The thing is, a couple of things. The AHS is already working on that. And she's blowing up AHS, bringing in Dr. Howell to look at this, improving the system in the next 6 months. That's just ahead of the next provincial election. People are saying, yeah, we should be looking at this. The thing is, a couple of things. First of all, we've been down this road a number of times, and specifically dealing with 9 years ago, the Premier at the time, Alison Redford, fired AHS, brought in Administrator Dr. John Cowell, the same guy who's now in charge, to fix the system. And at the time, Danielle Smith was the opposition leader for the Wild Rose and said this was just cosmetic changes, just political theater firing AHS and bringing in Dr. Cowell. She's done the very same thing, expecting to get better results this time around. So people do want things to improve. Everyone you talk to in the system says it can be improved. The thing is, the context here is that Danielle Smith won the UCP leadership very much on this vendetta against the healthcare system, saying that AHS, Alberta Health Services, infringed on people's rights by bringing in mask mandates and other mandates. Smith was promoting things during the pandemic like ivermectin as treatment, because that's quackery when it comes to treating COVID. And she has been very much running the leadership campaign that she won, of course, last month, on this idea of getting back at AHS and punishing them for infringing on people's rights. Her first day as premier, in that news conference, she said that people who willfully were unvaccinated faced the most discrimination of anybody she's ever seen in her 50 years on this planet. So she is very much in this vindictive mode. And here she is firing Dr. Hinshaw, this week, chief medical officer, and also then firing the AHS board, just saying, I'm doing this to actually help improve things. But the context is, this is how she won the leadership race, by being very vindictive and vengeful against people that she says infringed on Albertans' freedoms. And that played to a certain base, like 42,000 people, made her the leader. So she's still playing to that very angry base who thought that COVID, and still think COVID is overblown, if not actual, an actual hoax. Okay,
I guess the other question is there another shoe to drop, though, in the sense that you mentioned the campaign to become premier and become leader of the UCP. Danielle Smith also promised even deeper shake-up. She said she was going to basically take aim at all the senior, quote-unquote, all the senior health bureaucrats and the assistant deputy ministers. Is there yet more to come between now and the election?
Well, I imagine there will be, because Dr. Cowell, he was brought in 9 years ago, reduced the senior staff at AHS like by 80 or 90%. So the idea here, I think she wants to go after the senior management. She's talked about firing people in AHS who don't toe the line, like in other words, her line. There's a lot of red flags right now. There are people right now who have been critical of her, saying, okay, fine, we're going to hope that things change. I talked to the head of the United Nurses of Alberta yesterday, Heather Smith, saying that she got a phone call yesterday morning from Smith, and that's never happened. She said that Kenny, the previous premier, completely ignored the UNA, the Nurses Association. Here you have a courtesy call from the premier to Heather Smith, and Smith said, Heather Smith, that is, said, this is a great start. But even Smith is saying, look, there's no need to fire the entire board and start from scratch. You can make improvements. So they're hoping, people are hoping now that Smith will listen to more people in the healthcare system. But again, they worry that what she's doing basically right now is kicking the responsibility over to Dr. John Cowell, this new administrator, so that people do have questions about healthcare, why aren't things working, and why there's such long lineup. She can just say, look, I've got someone looking into it. And it may take 6 months to get a response.
And of course, we are in a pre-election period in a way, because we are anticipating the spring election. Well, listen, we will check in with you, no doubt. Again, I want to thank you for taking the time. Thanks for explaining some of this for us.
You're very welcome.
The public inquiry into the Trudeau government's invoking of the Emergencies Act has wrapped up its 5th week. In its last week, all eyes will be on the testimony from 7 separate federal ministers and Prime Minister Trudeau himself. This week, we began to hear the federal government's version of events, notably from the Prime Minister's National Security Advisor. And on Friday, Nancy Charette from the Privy Council office also testified before the Commission.
There was a degree of coordination, I think, amongst this set of activities that was very well financed. And so not only did we have what we had, but we had the risk of, and we'd seen this kind of, it would peter out and then it would escalate and peter out and escalate. But if you look over the trend, since the beginning of the protests, arriving on that beautiful day in Ottawa on the 28th of January, we had seen a trend of it getting worse and escalating and escalating. Taking together the culmination of all of that, it was my view that we met the test of the definition in the CSIS Act that was to be put before the Governor and Council to make a decision on reasonable grounds as to whether or not there was a national emergency that met the threat to the security of Canada, involving the threat of serious violence to people's lives, to their health and safety, to their security.
Well, to look at a very eventful week in federal politics, including the inquiry into the Emergencies Act, I'm joined now by two members of the Parliamentary Press Gallery. Tonda MacCharles is a national political reporter with the Toronto Star, and she's at the site of the inquiry. And Bob Fife is the Ottawa Bureau Chief for the Globe and Mail, and he's here with me in studio. Both of you, thanks for joining us.
Happy to be here.
Hi, Martin.
Okay, let's start with the inquiry. For weeks now, we have been hearing at the inquiry from police forces who have pointed the finger at each other for being unprepared or disorganized, who said that they never asked for the Emergencies Act to be invoked, but who have said that it did help somewhat when it was invoked. Yesterday, we started to hear the federal side of things, the federal framing of the issue. A crucial figure, the Prime Minister's National Security Advisor, Jody Thomas, she described why she decided that the occupation was a threat to national security, and she also put some of the blame for the need of invoking the Act at the feet of RCMP Commissioner Brenda Lucki. Tonda, your thoughts on that pivot and where the testimony, that sort of change that we saw this week?
Well, all week long, actually, we've been hearing, it wasn't just Jody Thomas, we've been hearing from senior federal officials, from senior RCMP brass, and then at the top of the national security and intelligence food chain in the PMO and the PCO was Jody Thomas's testimony yesterday. And look, I'm not sure that you could say she laid all the blame or part of the blame at RCMP Commissioner Lucki's feet, but she certainly took a broad side at Lucki for not advising the cabinet directly about the existence of an operational police plan that was, by then, we understand to have been at least finalized but not signed off on. And she did not directly advise the ministers at two key cabinet meetings that she was attending virtually, that she did not believe, actually, at that point, police had exhausted all available legal tools to them, and that, in fact, a plan in the works for Ottawa would use provincial emergencies measures. So it raises the question that had the cabinet ministers at that meeting known those two important facts, might they have delayed the invocation of the Act? We don't know. By then, the Windsor Bridge operation had been underway for 2 days. That bridge was, the blockades were lifted, the lanes of traffic weren't open, and what we've heard today, Friday, was that some of the very senior security officials in the Privy Council office advising the Prime Minister were very concerned that the Windsor Bridge blockade would start up again, that protests across the country, in their view, were not abating by then. They were, in fact, still escalating. There were some 10 blockades across the country that they were worried about. So I think that, hearing the national picture that was being fed into the cabinet decision-making is really interesting. Hearing senior bureaucrats involved in the decision-making taking shots at each other, and also saying, look, we've got a whole we've got a broader definition of what the threat to Canada was for invoking that Act than, you might see in narrow pieces of legislation. So all fascinating testimony leading up to a blockbuster week next week when we hear from the cabinet ministers and the Prime Minister.
We'll get to that in a second. Bob, your paper was commenting on the sort of repercussions on RCMP Commissioner Brenda Lucki, as Tonda mentions, if not blaming her for the Emergencies Act. Obviously there was, and she admitted, Brenda Lucki this week said that she admitted she regretted not bringing up these vital points, that there was a police plan to take care of the occupation of downtown Ottawa. Your paper's been talking about the kind of reputational damage she sustained.
Well, look, this was a very bad week for Commissioner Lucki. Her performance before the commission was, to say the least, rather disturbing. Tonda has outlined some of the testimony, but throughout the testimony she was vacillating, very weak, and this is not the first time. I mean, she made a mess of the Nova Scotia inquiry into the mass murder when she berated her officers and said that they should have released details on the guns that were used to kill those people, and because she wanted to help the Liberals' gun legislation. That spawned parliamentary committees. She almost immediately after she became a commissioner, she landed in hot water about saying that there may not be systematic discrimination within the RCMP, which is ludicrous. So she's not going to get reappointed. I'll put money on that. The senior officials I've spoken in the government have been very disillusioned, dissatisfied with her performance, not only in the inquiry and what Tonda has outlined, but on these other issues that I have. So she won't get reappointed because she shouldn't have been appointed in the first place. She was a mid-level depot commander. She had no experience in Ottawa, and you need to have headquarters experience because you are dealing with politicians and cabinet, and you need to have that kind of experience, which she did not have.
Okay, let's turn to, and Tonda alluded to it, and I think I alluded to it, next week is going to be a week, in a way it's a culmination of the whole inquiry. It's going to be a blockbuster week because we're going to hear from 7 federal ministers, Public Safety Minister, Emergency Measures Minister, Finance Minister, Chrystia Freeland as well as the Prime Minister himself. What are you anticipating? What are you watching for, Tonda?
Look, I'm most keen, I think, to understand what was in the mindset of 2 of the key ministers, the Public Safety Minister and the Emergency Preparedness Minister, Mendicino and Blair. And then, of course, what was in the mind of the Prime Minister. How were they processing the information and advice coming into them? And how were they viewing the level of police dysfunction that we've seen ample evidence of at this inquiry? To what extent did they get, we've heard at the inquiry police agencies saying, oh, well, the tools were useful, but they weren't needed. We were going to take care of the situation, when in fact, they weren't. Things weren't happening. Only at Windsor were things moving. And then the next morning, Monday morning, when the Emergencies Act was invoked, at Coutts did we see an enforcement action against a cache of weapons. But it was the protesters themselves, once that happened, that decided to leave because they realized their message was completely obscured. So I want to hear from those ministers. They were in key decision-making positions, and they were, I'm pretty sure, as a former Crown prosecutor and a former police chief who was at the G20, that their advice to Trudeau and the fellow cabinet ministers was pretty informative and key. And I guess everybody wants to know why Trudeau, who throughout the global pandemic and throughout the rail blockades of 2020 did not ever invoke the Emergencies Act and had never really wanted to because his father had invoked its predecessor, the War Measures Act. Why is it that they got to that point that they felt it necessary to bring down the hammer of the Emergencies Act?
Okay, Bob, because I want to get to another issue, but what are you watching for?
Well, look, the Public Safety Minister, Marco Mendicino, had said that the government invoked the Emergencies Act on the advice of the police.
That the police
that
asked
is not
for it.
true.
Yeah.
They've all testified that that is not true. In fact, we now even have the CSIS, our spy agency, saying it did not meet the threshold required for a national security emergency to invoke that. So I want to know, I think Marco Mendicino is going to be in trouble. I'd like to hear what he's going to say about to get himself out of that mess. Yeah. But also, what led the Prime Minister to do this? If CSIS says it didn't meet the Act, who was telling you that this was the right thing to do?
Or, as we heard from Jody Thomas, they are redefining the
nature
but you don't emergency.
If you're going to redefine it, then change the law to redefine it. You don't redefine it before.
Okay, we will be watching with interest. I want to get to the second subject of this week, and it really is one. The Prime Minister has wrapped up his Asian tour, and this was an undercurrent for the entire 3-summit tour: the ASEAN Summit, the G20 Summit, and the APEC Summit, which is just wrapped up. Canada-China relations. Justin Trudeau raised the issue of Chinese interference with Canadians and with Canadian elections. He raised it with Chinese President Xi Jinping. The next day, President Xi scalded the Prime Minister for making the discussion public, and more importantly, from people who watched that tape, he said there would be consequences. Bob, what are you watching for?
Well, look, I don't know whether there's going to be any consequences or not. I mean, they've punished us in the past, but our trade is actually up with them. Yeah. So I don't think we're going to be invited for any sit-down with the Chinese for a while. But what we need to see is, instead of Mr. Trudeau grandstanding, how about doing something concretely? For example, bringing in a Foreign Registry Act, which members of Parliament have been asking for, including members of Parliament who were defeated, we believe, because of Chinese influence. That's what we need. So we know who is working for the Chinese in public life and in corporations, and the Americans have it, the Australians have it. It's a very effective tool. So, Mr. Trudeau, if you're serious about this interference, do something about it.
Okay, Tonda, briefly, what are you comments on this overwhelming or underlying theme during all of this tour in Asia, the Canada-China relations?
Yeah, Canada-China relations, pick any Asian country, their relationship with China is also sort of a dominant factor. It's interesting that Justin Trudeau went there without having formulated his Indo-Pacific strategy. Let's see if there's going to be a big shift or changes as a result. Will he feel that he needs to take a tougher line on China? Will he do some of the things that Bob suggested? I think those are still big questions.
And, well, some say that the policy was semi-released by Madame Joly in the week before he left. But, yeah, it's still, the government says officially the Indo-Pacific strategy has still not been released.
Right. And it matters if it's just a white paper or if it's actually actions and money to boot.
Right. And you spoke to our new, Tonda, you had a sit down with a new ambassador to China. She mentioned that as well. It was a question about when will the strategy be coming out.
We should be getting it when
Well,
he comes back.
Yeah, I expect it within about a couple of weeks after Trudeau gets back.
That's it. They've been promising.
But, you know, I will say this. This is, what we've seen from the overview that Melanie Joly gave us is that there is a real movement from the government to recognize the credible threat that China is facing, not only in the Pacific, but also the world. This is a view that they have not, it's taken them a long time to get to this point. All of our Western allies have reached that point. We're finally catching up, and that's a good thing. I mean, the government should be complimented for that, and we've seen not only the Indo-Pacific strategy overview, but we've seen both Ms. Freeland and an innovation minister, you know, stopping Chinese takeovers of critical minerals. Ms. Freeland talking about how we're going to have to be friend sharing with other companies, so we don't just rely on China, which we've discovered during the pandemic, the supply chain problems we have. So I think the government's finally getting to a point where we're taking China more seriously.
Melanie Joly, who openly warned Canadian business people doing business with China that they are going to be, according to her, according to the government, dealing with a regime which she says is going to be less and less respectful of international standards and international law. Listen, we will watch for that. I want to thank both of you, and Tonda, we'll let you get back to the inquiry. Thanks for joining us, both of you.
Thanks, Martin.
And a reminder, we have continuing coverage of the Public Order Emergency Commission right here on CPAC. You can also tune in to our live stream of each day's testimony on our website at cpac.ca, and it's there where the full proceedings will also be archived and available for you. Well, that's all for this edition of Primetime Politics. On behalf of all of us here at CPAC, thanks for watching and have a great weekend.